Hello, welcome to my page once again. I'm Grace Asanana, a registered nurse, registered midwife in Nigeria, and a registered mental nurse in the UK. So today I want to go into assessment of a manic patient in mental health OSCE. And this is a disclaimer that I'm not a qualified OSCE tutor, but I'm doing this from the experience I've gained and I was able to pass my OSCE. So if you need a private tutorial, you can just send me a DM or you can comment here and I will reach out to you. So in assessment of a manic patient, what you have to do first is to assess your scene for safety. If your scene is safe, provide privacy to maintain the patient's dignity, and then decontaminate your hand according to the 7 steps of hand hygiene. I already did a video on that. Then you have to introduce yourself to the patient. Oh, I am Grace. I am a mental health nurse from the community, uh, sent by your GP to assess you. That is the introduction. Then you check for the patient's ID. While checking for the patient's ID, ask for the patient's name, compare with your documents. If the patient is in the community, the patient wouldn't have ID band. But if the patient is in the hospital, there will be ID band. So you have to confirm from there too. Then ask for the date of birth, ask for hospital number. And after that, ask for allergy. If the patient is allergic to anything, if the patient is in the hospital, there will be ID band, an allergic band that will signify that the patient is allergic to a certain kind of thing, maybe nuts, maybe eggs, penicillin, and so on. And then the associated reaction will be there. If the patient is allergic to anything, ask the patient about the associated reaction. Might be rash, might be vomiting, might be anything. Then you go on to confirm with the wristband if the allergy is there. Then you have to gain consent while you introduce yourself. Before you even do the ID check, gain consent. Ask your patient, please, are you happy that we go on with this assessment? The patient will say yes, and you go on with the assessment. So when you are given your paper for your assessment in a manic patient, you have 20 minutes to conduct your assessment. Please, after giving you your paper, don't rush into going into the assessment. Make sure you use about 4 to 5 minutes to go through your scenario and know the type of patients that you are. You might not know everything, but you have um another paper that you have to jot down things, something like this. Yeah, you jot down so that it can help you and guide you while you're asking your patient question, and you can also put down points there while asking the patient question. So let's go on with the scenario. Um, we have Mr. Okay, so in the patients, in the scenario that you'll be given, there is overview of recent history. The overview of recent history. First, you'll see assessment overview. The assessment overview will give you a clue to what kind of patient you're going to assess. You say bipolar disorder, manic episode. Then you say you are a mental health nurse working in a primary care mental health team in a health center. Mr. Raymond Jones has been referred to you by his GP after his wife expressed concerns about his mental health following the birth of their son 1 month ago. She states that Mr. Raymond is constantly writing, he is not sleeping, and is not eating meals, and she is worried about him. Please conduct a holistic mental health assessment using the recovery model of care areas below and including patient self-care and adherence to prescribed medication. You will be conducting the assessment on Raymond's home address. So you're doing it in the patient's home. The patient is not in the hospital. So you have 20 minutes to complete the station, including all the required documentation. So after that, you go to the next page, which is overview of recent history. You have to read the patient's overview and make notes. Make notes here. Yeah. So Overview of patient's history. You have patient history, name Raymond Jones, date of birth 1st 4th 1992. Then address 30 Close Road. Then there'll be a code. Then hospital number 34567891 That is it. Then the doctor's name, Dr. Blue. Then you'll see all those details. Then the next thing is presenting complaints. What are the presenting complaints? It will be written out there what the presenting complaints of this patient is. So read it and make a note. Then you come to past medical history. Past medical history that he has been diagnosed of bipolar disorder 5 years ago. Social history we have to do about his life, the marriage, his relationship, his marriage. He's married, he has a wife, he has a son that is 1 month old. His work, the kind of work he's doing, and if he's a smoker, an alcoholics, if he takes illicit substances, it will be stated in the social history. Then medication history, to state the kind of medication that he has been taking. And then allergies, if he has any allergies, it should be stated there. So what you have to do, you have to take 5 minutes of your time to go through all this and then the next page, and ensure that you know your patient. So after writing your points down, you're not to go through the patient's history again. What you have to just do is to go to your notes that you have made here and use it. So the note, the heading should be mood, relationship, major life events, living situation, patient self-care, non-adherence to medication, current risks, and additional notes, whatever you have to write. So here, mood, we've seen in the history that the wife was concerned that he has not slept for days, he has not eaten meals, he is worried about him, he's always writing, constantly writing. That means he's always busy. So, mood is elated. Then, relationship, he stated that he has a wife and he has a son that is a month old. Then here that the father and mother are separated, they are divorced, and they live separately. So you state that in the relationship. Then major life events, if there was a major life event, maybe pleasant event or a sad event like death of a loved one, or maybe something that has brought joy and happiness to him, you have to state there that under major life events. Then living situation, where is he living? Is he living in a rented apartment, or is he living in a mortgage house? Then how is he able to pay his bills? If he's really living in a rented apartment, how is he able to pay his bills? Then if he is living in a mortgage house, is if he's into a mortgage, how is he paying the mortgage? Is his fund able to take care of him and his family? Because if his fund is not able to take care of him and the family, it might also have an effect on his mental health. Then the next thing is patient self-care. So self-care, you have to ask how he's taking his shower, if he's able to take his shower, what has he been doing that has helped him to take his shower before his current mental state, his current situation. Then if he's able to tell you, you can ask him to bring those things, those habits again that helped him. Maybe he was always prompted by his wife to shower, or maybe since he was going to work, or maybe always set his alarm to help him shower. Then talk about the sleep in self-care. Talk about the sleep. How have you been sleeping? Have you been able to sleep? He might tell you, oh, he has not been able to sleep. He has been into writing. There is a project he's pursuing, and this project will really give him enough money. So he wants to finish up with the project. When he's done, he will be able to sleep. So ask him how he has been sleeping before now. If he was always sleeping maybe 6 to 8 hours in a day, ask how what helped him at that time to be able to sleep well. When he mentioned that to you, encourage him to use those techniques to help him sleep. Then you can also suggest to him, oh, that if you want to if you sleep, it will help you to bring good ideas into this your writing, into this your business, so that it can help you. If you don't sleep, you might not bring ideas that are good into this your business plan. Then you can also tell him that sleeping will make him have think very well and be creative more than being busy all through. Also inform him that um, some people, when they want to sleep, they set aside everything that can distract them. Maybe 30 minutes before the time of sleep, they can put off their devices like their television, their music, um, headsets, their phones, put them off and dim the lights 30 minutes before their sleep time. That it might help them to sleep. Then when you're done, talk about his feeding, how he's eating, uh, how how he's eating, how has he been eating before, what kind of food he likes, and ensure he tells you. Then you can ask him what will he want you to do to help him to at least be eating. Then since he's always busy writing, that they can provide finger foods uh, around where he is, so that he can just be picking it to eat. That one, it will help him with his feeding, and it will help with his nutrition. Then ask him about his uh, alcohol. Ask him how he is taking alcohol, and then other illicit substances. If he's taking alcohol, you can inform him about the effects of alcohol to the body, and that the alcohol enhances the effect of antipsychotic. You can also inform him that uh, alcohol, if you can't, don't tell him that he should stop drinking alcohol. Just ask him if he would like to stop. If he doesn't want to stop, just inform him. If you want to stop, you can reach out to us, and we'll give you a literature, or we'll introduce you to Alcohol Anonymous group that will help you to in the reduction or to stop your alcohol consumption. Then you get into medication. Ask about the medication, even if they've already written here the kind of medication the patient is taking. Don't just say, oh, I know you are taking this and that. Ask, what is the medication that you're currently taking? How have you been taking the medication? Are you sure you're adhering to the medication? You might say, oh no, I'm not taking the medication because it makes me sleep too much. I am not creative when I take the medication, so I don't want to take it again, or I take it I adjust it. I take it maybe once in 2 days or so. Then ask, have you been able to speak with your GP about this? If he has not, encourage him to speak with his GP, so that there may be a review of his medication. Then that is that. Before then, in the diet, in eating, when you ask the patient if he's able to eat, also encourage him to seek a the help of a dietitian that will help to plan his meals. And current risks, ask the patient if the patient is at risk to himself or others, if he has any risks of harming himself and others. The patient might say no, that he doesn't think of harming himself or harming others. Then suggest for hospital admission, because at this stage the patient is in a relapse of bipolar disorder, is in a relapse of his manic phase. So you you have to encourage the patient to be admitted in the hospital. Encourage him that, don't tell the patient, oh, you have to come to the hospital, we need to admit you so that you'll be able to take your medication, you will be able to have your shower, you'll be able to eat and sleep well. Just uh, tell the patient that why you suggest hospital admission is that the nurses and the medical team will help to support him so that he can be better. He will be able to ensure his project, his writing, his business plan are put in place. They can assist him with social services that will help to ensure him to put his plan in place, his business plan. So all those things like shower, eating, sleeping, the patient can do it while at home. But since there is relapse in mental state, the main thing is that the patient has to be admitted in the hospital for proper care. So that is that about assessment. After conducting this assessment, you thank your patient for the time that the patient has given to you, and you didn't contaminate your hands according to the 7 steps of hand hygiene. And that is that. So if there is any question, if you have any comments, if you have any worries, you can reach out to me. Thank you.